This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: What is familial dyslipidemias type I? Answer: Familial dyslipidemias type I is also known as hyperchylomicronemia. Question: How is familial dyslipidemias type I inherited? Answer: Familial dyslipidemias type I is inherited as an autosomal recessive trait. Question: What is the pathogenesis of familial dyslipidemias type I? Answer: The pathogenesis of familial dyslipidemias type I is caused by a deficiency in lipoprotein lipase or APO102. Question: What are the increased blood levels in familial dyslipidemias type I? Answer: The increased blood levels in familial dyslipidemias type I include chylomicrons, Tg, and cholesterol. Question: What are the clinical features of familial dyslipidemias type I? Answer: The clinical features of familial dyslipidemias type I include pancreatitis, hepatosplenomegaly, and eruptive, pruritic xanthomas. It does not carry a risk for atherosclerosis. Question: What is the creamy layer in supernatant in familial dyslipidemias type I? Answer: The creamy layer in supernatant is a characteristic feature of familial dyslipidemias type I. Question: What is the role of lipoprotein lipase in familial dyslipidemias type I? Answer: Lipoprotein lipase is an enzyme that plays a critical role in the metabolism of lipids in the body. In familial dyslipidemias type I, there is a deficiency in this enzyme, leading to the buildup of chylomicrons and other lipids in the blood. Question: What is APO102 and its role in familial dyslipidemias type I? Answer: APO102 is a protein that plays a crucial role in the metabolism of lipoproteins. In familial dyslipidemias type I, there is a deficiency in APO102, which leads to the accumulation of chylomicrons and other lipids in the blood. Question: What is the significance of elevated levels of chylomicrons, Tg, and cholesterol in familial dyslipidemias type I? Answer: Elevated levels of chylomicrons, Tg, and cholesterol in familial dyslipidemias type I can lead to various clinical manifestations, such as pancreatitis, hepatosplenomegaly, and eruptive, pruritic xanthomas. Question: Can familial dyslipidemias type I lead to atherosclerosis? Answer: No, familial dyslipidemias type I does not carry a risk for atherosclerosis. Question: What is the creamy layer in supernatant in familial dyslipidemias type I? Answer: The creamy layer in supernatant is a characteristic feature of familial dyslipidemias type I and is observed when a sample of the patient's blood is centrifuged. The creamy layer is composed of chylomicrons and other lipids that have accumulated in the blood due to the deficiency in lipoprotein lipase or APO102. Question: What is the treatment for familial dyslipidemias type I? Answer: Currently, there is no cure for familial dyslipidemias type I. The main goal of treatment is to reduce the risk of complications, such as pancreatitis, by controlling the levels of chylomicrons and other lipids in the blood. This may be achieved through lifestyle changes, such as a low-fat diet, and medications, such as fibrates and niacin. Question: How is familial dyslipidemias type I diagnosed? Answer: Familial dyslipidemias type I is diagnosed based on the patient's clinical history, physical examination, and laboratory tests. Blood tests can reveal elevated levels of chylomicrons, Tg, and cholesterol, while a diagnostic lipoprotein electrophoresis can confirm the presence of chylomicrons. Question: Can familial dyslipidemias type I be prevented? Answer: No, familial dyslipidemias type I cannot be prevented as it is an inherited condition. However, proper management and treatment can help to reduce the risk of complications and improve the patient's quality of life. Question: Are there any genetic tests available for familial dyslipidemias type I? Answer: Yes, genetic tests are available for familial dyslipidemias type I. These tests can help to confirm the diagnosis and determine the specific genetic mutations responsible for the condition. This information can be used to predict the course of the disease and guide treatment decisions. Question: What is the prognosis for patients with familial dyslipidemias type I? Answer: The prognosis for patients with familial dyslipidemias type I depends on the severity of the condition and the patient's response to treatment. With proper management and treatment, most patients can lead a normal life and reduce their risk of complications, such as pancreatitis. However, some patients may experience severe and recurrent episodes of pancreatitis, which can lead to long-term complications and reduce quality of life.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the First Aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.